Hey guys, in this video, I'm going to provide you guys with some practical self-care tips to help you manage white coat hypertension if you've been diagnosed with it. And before I get started in the tips on how to manage, disclaimer here: I'm not a doctor or medical professional. I have been diagnosed with white coat hypertension, and I just want to share with you some of the things that I'm doing to help me manage it when it comes to high blood pressure or white coat hypertension. Always check with your doctor before you try anything. Always check with your doctor or another medical professional. These are just some practical tips, some things that I'm doing to help me manage it, and so I thought I would share uh, this with my community and with others who have been diagnosed with it. So, with that said, a little bit about me if you're new here. My name is Allison. On the channel, I provide holistic health and wellness, practical self-care tips for Black women over the age of 50 to aid them in obtaining optimal health, age gracefully, and to live the life that they desire and deserve. Oh yes, and before we get started, I have a few notes here. So if you see me looking down, I am referring to these notes. I definitely will probably be doing it more in this video because I want to make sure that since it is a critical subject when it comes to blood pressure, I want to make sure that I'm staying on track and not just be talking too long. So, with that said, let me get started. Oh yes, and by the way, if you can hit that like button, I want to make sure others, this video shows up in other folks' YouTube feed. So let's get started. Oh, and before we get started with the tip, let me just give you like a brief definition on what white coat hypertension is if you're not familiar with it. And white coat hypertension is a condition in which a person's blood pressure is higher in a healthcare setting, at the doctor's office, at a hospital, than any other setting, such as when you're at home or when you're in a relaxed environment. It is called white coat hypertension because when taking the person that is taking the person's blood pressure, well, it used to be, now it's changed, but in some cases they're wearing a white coat. The stress of the healthcare checkup may cause the blood pressure to increase. And according to medical studies, white coat hypertension affects 1 in 5 American adults, including those with and without hypertension. And just some of the causes: it's a temporary spike in your blood pressure reading in a healthcare facility, as I mentioned earlier, when you're going for your doctor's appointment. And this can again include people that have never been diagnosed with hypertension. And I know for me, usually like the day of or the day before my doctor's appointment, I start tripping. I mean, my anxiety gets like really high, and that day of or going to it's funny now, but when I'm driving to the doctor's office, I could just already feel my anxiety just going up for some reason. So again, it's temporary, and for some people that have never been diagnosed with hypertension, on most cases, in all cases, your blood pressure is normal in a relaxed environment or when you're at home. It's only when you're going to maybe a medical facility, a doctor's office, or hospital, your blood pressure tends to elevate and rise. Um, who is usually at risk for developing white coat hypertension? And this is based on studies. It tends to be older people, people that are over the age of 50, women, yeah, people who have been diagnosed with high blood pressure, or people that have other chronic illnesses. And even those that have been diagnosed with high blood pressure, sometimes going to the doctor's office, it will even get any higher. Um, Smoker, people that are women that are pregnant women, and folks that are obese. So these are just some people again that are might be at risk of white coat syndrome. And so now let's get started with the just some of the tips. And again, I can't stress again, these are just some suggestions, but always just check with your medical professional or your doctor whenever it's concerning your blood pressure. So the number one thing, and my doctor, they recommend that I monitor my blood pressure. So I tend to take my blood pressure, if not every day, every other day. So I keep a track in a chart of it. I'm in a log. I log it, I track it, and keep a log of it. So monitoring your blood pressure at home, if you don't have a blood pressure device, you can go to your in a pharmacist. Most pharmacists have a blood pressure machine there, so you want to make sure that you're monitoring your blood pressure on a consistent basis, and keeping a track of it, and it keeping a track of your blood pressure to show again under normal circumstances your blood pressure is always normal, and your doctor will let you know what your normal is. Some studies say 120 over 80, but check with your medical professional on what your normal is. But the number one tip is to monitor, keep a track of your blood pressure on a consistent base. The next thing that you want to do, oh yes, in the description section of this video, as I mentioned earlier, I keep a track of I monitor my blood pressure, and I keep it in a manual log. And I when I go to the doctor's office, I take the log with me. And in the description section of this video, I'll leave a link of the tracker that I use to help me monitor it. The number 2 tip on my list is to communicate. Communicate with your healthcare professional by being open and honest with them, and talking with them to let them know how you're feeling, and then if you're feeling nervous and anxious. And I tell you, for me, as soon as I get in the door, and when they call me in the back to start taking my vitals and taking my weight and everything, I let them know straight up, I'm nervous and I'm anxious right now. So I need to either wait to after. And sometimes once I get in, I get to talking with the doctor or talking with the nurses, I calm down. But just leading up, and then that day before, I be tripping. I'm just nervous. And but I communicate with them to let them know I'm nervous. And my blood pressure is probably going to be high. So um, I need for you to, if you have to take it now, I need you to come back and take it later, or I need to wait until I calm down. And for me, that has helped with the doctor diagnosing that. Wow, when we look at her log versus on when she arrives, we know that this is what's going on with her. When she gets into this environment, it makes her like really really nervous. So these two things definitely work together for me, keeping that log. And when I get there, I know it might be, might be high sometimes, that they can see, oh, it's when she gets here. That's how they were able to diagnose me. um another thing, and this is all in relationships. This is number 3. This is all in relationships with the communication, is developing like a really good relationship with your provider, and not just your doctors, your nurses, even the people that the healthcare professional, the person that's drawing your blood. I let them know, and for some reason, you can take all the blood out of me by the time by the time the way when if I'm going for my annual exam, and the way my wellness exam is set up, taking my blood is like the last thing. And by the time I get to the technician to draw my blood, I'm just as calm as a cucumber. But I let everybody know that's going to be touching me, what has transpired. But by the time I get to was taking my blood, I've calmed down, and I've shared that with the technician that's drawing my blood, and everyone is, because I communicate and let them know. Everyone is just really understanding, and in fact, I know some of the medical professionals say they work in that environment, but when the shoe is on the other foot and they're the patient, then they get really nervous. So they all are understanding and know where I'm coming from. So as I mentioned, number 2 is communicating, but then just developing like a really really open and good relationship with all your medical professional. And that's all. So even if you're not going for your annual wellness exam, when I go for my annual female exam, wherever doctor medical facility I have to go to, I let them know, hey, this is what's going on with me. And again, I keep my log with me, so they know. And then it's documented too on my medical records. Some other things too, some relaxing and some breathing techniques, and this helps me on occasion. But it's just taking time to breathe in through your nose. And what I just did was breathe in on the count of 4. I breathed in on the count of 4, held it for a count of 7, and then breathe out on a count of 8. And that really helps greatly with bringing some calm. It helps me calm down, helps me relax my nervous system. So finding different breathing techniques you can do. That's the 4-7-8 breathing techniques. There are some other breathing techniques that you can do. It's called like boxing, boxing technique. There's also like a sensory breathing technique where you find 5 things in the room, or see if you can touch 4 things, or smell 3 things, or hear. So there are different types of breathing techniques, mindfulness techniques that you can do to help you just calm down and calm your nervous system. You can also maybe listen to some relaxing music. You could try maybe meditating. You could take a coloring book with you, a crossword puzzle, just something to help you take your mind off the doctor's appointment. You can say positive self-talk to you, and just remind yourself that you're safe. You're going to the doctor, especially if it's just a regular wellness routine. You're just having positive talk and telling yourself that it's okay. You're going to the doctor to this one way for you to take care of yourself, and that's just one way, that one thing that you need to do to make sure that you're taking care of yourself is to know what's going on with yourself. So just positive self-talk. Maybe calling a friend, a family member. This was recommended to me. I haven't tried this one because my thoughts was, I don't know if I call someone before I go, and depending on what's going on with them, and if they might be having a bad day, especially if it's a close family member, I can sense it in their voice, and then I'm going to get concerned about what's going on with them, and that might make me a little bit more agitated. But you can give that a try, calling a family member or a loved one or a friend before your appointment, or to see if that will help. Another thing too that can help, and this was not on my app, I mean on my paper, but try arriving early. Like if my appointment is at 9:30 in the morning, I try to get there at least by 9 o'clock to give me time to, so if I need to do some breathing exercises, or do a crossword puzzle, or say some positive affirmations or something to myself to help me calm down. But arriving early. You can download some calming apps. This Excel app, and in the Excel app they have a lot of different features on different breathing techniques, meditation, just a variety of different techniques that will probably aid you in calming down. And drinking water, maybe drinking some water can aid too with helping you calm down. So, well, that concludes my list of a few tips for those of us that suffer from white coat hypertension. Again, I'm going to stress to you, don't self-diagnose yourself. Always check with your doctor, your medical professional. But I suffer from this, and as I mentioned earlier, 1 in 5 Americans do suffer from this. So I thought I'd just create a video and offer some tips, some things that I'm trying to help me manage it. And if you're one of those, that 1 in 5 that suffer from white coat syndrome, in the comment section, please let me know some of the things that you're doing to help you manage white coat hypertension. Please like this video. I want to make sure that other women, other like-minded women that are just on the mission of taking better care of themselves sees this information. Don't forget to subscribe to the channel, and I will see you in the next video. Take care of yourself. Bye.